The serratus anterior. This is a very important posture muscle which also assists in breathing, so weakness of this muscle affects your posture, spine, and your overall health, as breathing is an important function we often overlook. The serratus anterior originates from the anterior ribs number 1 through 9 underneath the chest muscles. It courses around the side of the body and inserts into the ventral medial aspect of the scapula, which is also known as the shoulder blade. This muscle is supplied or innervated by the long thoracic nerve, which comes from cervical vertebra C5 through C7. The first job of any clinician should be to check the spine and remove interference if the nerve is compromised. The C5 through C7 segments are commonly misplaced. They take the majority of force in a whiplash injury, and the most common segments to have disc degeneration or disc herniations, which compromise the nerve. It is easy to see why so many patients have a weak serratus anterior and winging shoulder blades. A weak serratus anterior muscle or compromised long thoracic nerve will present as pictured. A primary function of this muscle is to hold the shoulder blade flush against the thoracic cage. Weakness will reveal a winged scapula appearance, which is very common. The majority of this muscle is hidden underneath the pectoralis major muscle. The lower portion of this muscle is visible to the naked eye on thin people, athletes, and bodybuilders. It has a sawtooth appearance in the front, and that's how it gets its name, the serratus anterior. The action of the serratus anterior muscle is the ventral lateral movement of the scapula. It also stabilizes the scapula and rib cage and assists in breathing. One way to imagine the action of the serratus anterior is to imagine reaching as high as possible to pick an apple. That last little movement of the back is the serratus anterior. I used to think bodybuilders were just showing off when they were doing exercises with just one arm. Now I realize they were smart, and the serratus anterior is a major muscle that gets activated when you do upper body exercises with one side of the body. When there's no equal force to counteract the exercise, you engage the muscles in a completely different way. When doing one-armed incline presses, the serratus anterior grabs the rib cage and holds the scapula against the thoracic cage. This complex muscle is hard to isolate because it's basically involved in every movement of the upper body. Here are 3 great posture exercises that engage the serratus anterior, all in unique ways. I like to use the word engage because we want the muscles to be toned, but we also want them to be flexible and functional. Tight and contracted muscles only contribute to poor posture. The supine dumbbell pullover. This is one of my favorite posture exercises, but it has to be done correctly. You should place a dowel or a rolled up towel underneath the neck to support the normal cervical curve. Probably one of the most important aspects of this exercise is the breathing. Remember that the serratus anterior attaches to ribs number 1 through 9 and assists in breathing. I like this exercise because it really pulls up on the sternum and rib cage, which is what we're trying to accomplish with posture. Make sure you take a deep breath in as you're going back and blow it out slowly when you're bringing the dumbbell back up. Never hold your breath and breathe with each repetition. If this exercise causes pain in the neck, shoulder, elbow, or wrist, lighten up the weight or discontinue. A 5-pound dumbbell should be plenty if you're first starting this exercise. The single-handed seated row is an excellent exercise for posture and to train your scapulas to glide easily along the thoracic cage. In the seated position, with one arm, you can reach a little bit further and engage the serratus anterior while working the antagonistic rhomboid muscles. When your arms become fully extended, reach and twist just a little bit more from your back and you will feel the engagement of the serratus anterior under the arms. This exercise will also give you definition under the chest muscle. Keep the form perfect. Remember, we're toning and stretching, not bodybuilding. 3 sets of 10 repetitions for each side. As the name implies, I could not find the name for this exercise anywhere. I've been doing these for 30 years, and it's an excellent stretch for the pectoralis minor muscle while engaging the serratus anterior and abdominal obliques. If you do these correctly, you will have sore serratus anterior muscles the next day. The most important part of this exercise is to grab the mat above your head at about 45 degrees. This is a great stretch and targets the pectoralis minor muscle when you rotate the pelvis to the opposite side. This exercise is contraindicated if you have a disc problem with pain radiating down the leg. As always, if this or any other exercise causes you pain, discontinue immediately. 3 sets of 10 repetitions for each side. This will conclude the Serratus Anterior video. Remember to think about the action of the shoulder blades when doing these exercises. Breathe with each repetition and make a conscious effort to engage the Serratus Anterior muscle.